We spoke with the governor from Annapolis. Governor, today you ordered non-essential businesses closed. Let's start with why. Why was that necessary?
Well, we're trying to save the lives of thousands of Marylanders, Jeff, and we just decided we needed to take that action to try to keep more people in their homes. Many states across the country have ordered shelter in place. We just went in a different direction. We're trying to really strongly encourage anybody who doesn't absolutely have to stay in their homes, but we're trying to keep keep the option open for people to go out as long as they're not congregating in groups. But we closed all the schools. We're one of the first in the country to do that, and then we closed bars and restaurants. Again, one of the first states to do that, and we've continually been ramping up in response to this rapidly growing coronavirus threat. And today we just took further actions based on new guidelines that came out from the Department of Homeland Security on Thursday, talking about essential versus non-essential businesses. And we had a 678% spike in cases over the weekend, and that prompted the additional actions just to try to keep more Marylanders safe.
So it sounds like this is a step short of shelter in place. What are individuals, businesses allowed to do? Who can be open and who can patronize those businesses?
Well, so there's a long list of about 1,000 different businesses we don't have time to go through, but they're essential businesses that we're going to keep the supply chain open to make sure people are getting the basic things that they need. You know, stores and pharmacies and banks and all of those things you would normally think of as essential, along with healthcare, if first responders, so doctors and nurses, hospitals, government functions that are providing basic public safety functions. All of those things are still open, and many other businesses, for example, they're in the supply chain making sure we get people the things that they need, but manufacturing, people that are doing construction maintenance and keeping things operational. But certain other non-essential businesses just that don't have to be open during this crisis, we want to keep them closed so we can keep more people home and keep more people social distancing, so we can break the back of this coronavirus strain. And it really has the potential, hopefully, to keep a couple 100,000 Marylanders from getting the disease, and to keep us from losing a couple thousand Marylanders, and to keep us from overloading the healthcare system all at once, where we don't have enough emergency room capacity, enough ICU beds, or enough ventilators, or personal protective equipment. And that's the kind of thing you're hearing about all across the country. We don't want to look like Italy. We don't want to look like New York. And that's why we've been taking these aggressive actions. But we also announced today a lot of steps to help businesses, particularly small businesses, and those people that are affected, people that are losing their jobs or who are going without a paycheck. So a whole list of economic stimulus efforts to try to help those folks, because we're really fighting this dual problem of the health and safety and saving lives, at the same time trying to help protect our economy, those small business owners and those people who are being impacted by not being able to go to work.
Governor, there was a tweet from the president saying that he was concerned that the cure might be worse than the problem itself, I guess referring to the economic pain that this is causing across the country. He wants to revisit the situation in a week or so. How do you feel about that trade-off?
Well, it's a terrible choice to make, and I don't think it's really a trade-off decision we can make. I mean, some of his experts, Dr. Anthony Fauci, who is the guy who's heading up this effort at the federal level, has talked about the difference between millions of Americans dying or tens of millions of Americans dying. We're talking about, if you just look at the nightly news and you see what's happened in places like Italy, or if you see what's happening right now in New York City, where they're talking about the massive shortages, these are the kinds of things we're trying to stop from happening. And there's just multiple messages coming out of the administration. Obviously, no one wants to hurt the economy and hurt people economically, but we also do want to protect people's health. That's our number one job, is to protect the health and safety of our citizens. And we've got to try to do both of them at the same time. And it's not a great choice it's a terrible choice to have to make, and that's why we've got to fight both of these wars at the same time, and that's exactly what we tried to do today and what we've been trying to do for weeks, which is why almost every single day we've taken action in both directions, fighting both of these fronts.
How is the healthcare system in Maryland holding up? You mentioned opening up some new facilities. Where are we in terms of capacity right now?
Well, we're trying to increase the capacity of our Maryland healthcare system and our hospital beds by 70%. We're trying to add 6,000 hospital beds to be able to handle the potential surge capacity. That's almost an impossible task to do overnight. But just last week, we through just some additional steps that we took with some of our existing infrastructure, we're able to free up 900 additional beds immediately. We're going to have 1,400 additional beds up and operational by April 1st. We announced today that we, through a joint venture between our Maryland National Guard, the Army Corps of Engineers, working in conjunction with University of Maryland Medical System and Johns Hopkins, we're going to open up a 250-bed field hospital in the Baltimore Convention Center. We're going to reopen the Laurel Hospital in Prince George's County. And all of these are just unprecedented actions to try to get on top of this. And we're also working, I led a call with 52 of America's governors and the vice president and the top leaders of the federal government today, pushing federal leaders to try to help us continue to move forward on all of these issues, FEMA and other agencies, HHS, to try to help get these hospitals operational, but also to help us with these issues of the materials that we need on testing, on the personal protective equipment, on ventilators, and all of this stuff that's going to be critically needed if we have these surges in our hospitals, which you're seeing now in places like New York and California and the state of Washington.
Two more questions, if I can. The availability of testing right now, the physical tests, and the idea that Maryland is going to open some drive-through testing locations. Who's that for? When does it start?
So we've increased our testing capability just in the past 3 or 4 days by 500%, but it's still nowhere near where we need to be. We were one of the first states in America to receive approval to do our own testing. A number of private labs are rapidly ramping up their testing capabilities here in the state. And Johns Hopkins is doing testing. We've got these private facilities that are ramping up. We just got approval today to purchase some additional tests through China. And one of the other things I announced today was an executive order I signed to allow us to move forward without the federal government approval, without FDA, to go ahead and vet our own test and to move forward with the expedited approval to save months off the process to be able to go and get our own testing approved. We also got a great deal of shipments in from the federal government through some of their emergency stockpiles. So we're getting help in all directions from the federal government, from outside of the state, from inside of the state. But it's still obviously far short of what we need. So the current testing is going to be prioritized for those people who are inpatient, people that are in hospitals that really need the tests. And then those folks that the state health department is tracking in their investigations for somebody that's been infected, who they came in contact with. Not everyone does need a test. So if you just have the sniffles or you feel like you're not, you may have a cold, you don't necessarily need a test. So you go on coronavirus.com, you can see all of the symptoms. If your doctor or your hospital really decides that you need a test, we're going to hopefully have those tests available. What we don't need are just tens of thousands of people clogging up the system and overloading it where we don't have tests available for those people who desperately need them.
Last question. You're in meetings morning, noon, night, middle of the night. Probably don't get to see a lot of real people. I was in a grocery store first thing this morning. There is fear and anxiety like you haven't seen in this country since 9/11 or maybe before that. Just looking at people going about their shopping frantically. What would you say to Marylanders? When can we hope to maybe not sound the all clear, but put the majority of this behind us?
Well, first of all, I would say to Marylanders that I do understand the fear and anxiety, and I understand that it's a terribly difficult time. I know that people their lives have been disrupted, and we've never gone through anything like this before in my lifetime, anywhere in the world, let alone here in America or in the state of Maryland. And I don't have, honestly, I said this earlier today, we don't have the answer about how bad is it going to get and how long is it going to last. All I can do is promise you that the best possible people here in our state and are working around the clock to try to do everything we can to keep you safe and to save lives. And we're going to keep doing so. And I believe that if we all pull together, we really are all going to get through this. It's going to be a tough time, and quite frankly, it's going to get worse before it gets better. But I promise you that we're going to come out of it, and it's going to take every one of us in Maryland working together to make sure that we help protect each other. And you can help by staying home and by helping us break the back of this thing by not spreading it around the state.
Governor Larry Hogan, we appreciate your time. We'll let you get back to work. Thanks very much.
Thank you, Jeff.